Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. Today, we have the class. I am taking the regular classes. So, today's class is related with Bal Rog or Ayurvedic Pediatrics. It is also called as Kaumarbhritya tantra, that is Ayurvedic pediatrics. And today we are going to discuss about the teeth, that is called as a Danta in Sanskrit or Ayurveda. So that is a tooth or the teeth. Tooth is a singular and teeth is a plural. But before starting this topic, I would like to give you important questions which have already asked on this topic. So listen carefully. Discuss Dantodbhava, Udbhava, Prakriya, Dantodbhava, Prakriya. That was the question. Next question, Danta Janma Prakriya, Danta Janma Prakriya. I am giving you the terminology. So listen carefully the pronunciation. Next, note, N-O-T-E, note. Kashyap Viva. Kashyap is the best text for the Kaumarbhritya Tantra. He is the great scientist for Ayurvedic pediatrics, Kashyap Samhita. Kashyap view regarding Danta Janma. This was the question. Next question, Danta Sampat. Danta Sampat, best quality teeth. That is characteristics of healthy teeth. Characteristics of healthy teeth, Danta Sampat. Now I will request, open your textbook, write down the date, 13th of December 2023. The class is Kaumarbhritya Tantra. Topic, Danta. Topic, Danta. Now write down one word, Danta Sampat. I will give this. This word you write down. Very important one. Danta Sampat. Write down in English. Healthy teeth. Healthy teeth. Best teeth. Best. Again, the question is Danta Sampat, then Dantodbhavahanya Vyadhi. Dantodbhavahanya Vikar, V-I-K-A-R-A. Vikar means diseases. Okay, so these are the probable questions. Now I will discuss some of the points that are on the screen, and then if the time permits, I can give you some audio information more. Let us start. I will mark slowly, steadily. Even in the oral, you will be asked by the examiner, tell me Danta Bhed. Tell me Danta Bhed. So you have to tell these 5 types. Raj Danta, here. Central incisor, here. Central. You keep your mirror in front of you and revise yourself. Central is a Raj Danta. Then just neighbor to that Raj Danta, they are Vast Danta. That is central incisor, then lateral incisors. Then Drashta Danta, like the dog. Drashta Danta, canines. C-A-N-I-N-E-S, canines. Swarudha Danta, that is premolar on the back side. And then Hanavya Danta, premolar and extreme last here. Extreme last. That is the molars. Okay. So I think we can count it. 4 plus 4, 8. Then 12 plus 12, 24 plus 8, 32. We have added 32 teeth. And the main function, please write down the main function of teeth. What is that? Charvana, Sanskrit word. Charvana. And in English, mastication. Please write down M-A-S-T-I-C-A-T-I-O-N. Mastication. Nang. to cut the food particles. Then it will be formed as a bolus with saliva, with the tongue, and then that bolus enters into the esophagus. But if your teeth have the problem, you can have problem for digestion. Very important, because when we bite, then the saliva starts, lot of fluid will be there, and salivary amylase is there, very good enzyme. So carbohydrate digestion starts in the oral cavity, not in the stomach, oral cavity. And that is why whenever we masticate, chewing only chapati, wheat chapati, or only bread, even without any curry, without any sabji, without any vegetable, without any sweet, only chapati, then also it starts giving you the taste, sweet taste. How that sweet taste comes? Because of the mastication, saliva, salivary amylase enzyme, it starts digestion of carbohydrate. And so glucose develops sweet taste. Now there are a lot of problems in the public, in the patient, lot of patients of, so dental doctor is a very good income, very good income. Why? Because we are not following the hygiene of the teeth. No, nobody is following. Remember this basic thing. It is applied to the children, it is applied to the adult, both. So we are learning little dentistry, dental science, very important teeth. So when we don't brush properly, actually it should be done minimum 2 times, early in the morning, because lot of bodhaka kapha is there in the kapha secretions, and in the evening before going to the bed, after dinner also you must brush the teeth. Now people don't know how to brush. They do, for example, this is a brush like this, transverse. This is very wrong. This is not the way of brushing. No. Because you will destroy your enamel, and that enamel is very important, covering, coating. If you lose the enamel, the nerves are get opened, and then there is a hypersensitive teeth. Hypersensitive teeth because enamel loss. And why? Because brushing style is wrong and not cleaning, or some more acidic food you are eating, then enamel is lost. Be careful about enamel. Sensodyne toothpaste, you know the advertisement, Sensodyne toothpaste, to prevent the damage from the hypersense. If the teeth are becoming hypersensitive, what will happen? You cannot tolerate cold, you cannot tolerate hot, you cannot take hot and cold, no, cannot eat the ice cream, cannot take the tea, because loss of enamel. Then there is a problem, not cleaning, then carious tooth, yellow plaques are developed, carious. Then after carious, there will be cavity, hole will be there, and then infection will go at the bottom, at the root, and then you have to do the root canal treatment, minimum 10,000 rupees for one tooth. Okay, so these are the something basic things you must know. In Ayurveda, kaval and gandush are very important. Kaval and gandush for the mouth. When you can move the liquid, that is kaval, and when you cannot move that much quantity of the fluid, then that is gandush. A simple thing is a gurgling, mouth gurgling. Ayurveda says, tila tail, sesame oil, kavala or gandusha, best to prevent, to protect your teeth enamel. This is the treatment for hypersensitive teeth. Kaval or gandush of the sesame oil. Every day 5 minutes. Warm sesame oil, and then spit it out. So these basic things. Then in the market, Danta Kanti, from that Patanjali. Good product. Ayurveda says don't use the sweet taste, but you can use the bitter taste. No salt. Bitter taste is very good. Little pungent taste to clean the kapha. So these Khadira, Babul, these are the names. Triphala powder, very good. Triphala powder. So these basic things. Then there is a tablet G32 to protect the 32 teeth and the gums. The tablet name is a G, capital G, G for Ganpati, 32, 32. These are the name of the tablets in the market available, Allersin company. So these are some basic things. Now let us see what to do about Dantodbhavahanya Bhed. Dantodbhavahanya. So, Samudga, Samvrita, Vivrita, and Danta Sampat. These are the different types of the teeth according to Ayurveda. What is Samudga? Early and easy decaying and weakness of the teeth. It will fall down. That is Samudga. Then Samvrita, that inauspicious or remain dirty. So this is pathology. This is pathology. Vivrita, cause excessive salivation, not fully covered with the lips. So they are little bit opened. That is called as a vivrita, little bit opened. So first three are bad, bad, bad. But Danta Sampat, best. This is physiological, this is pathology, this is pathology, this is pathology. Easy decay, Samudga. Dirty teeth with tartar, T-A-R-T-A-R, tartar, yellow, 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 brown, 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 tartar. That is Samvrita. Vivrita, excessive salivation, not fully covered with the lips. Danta Sampat, best teeth, healthy teeth. Let us see what are the qualities. This is a question asked. What are the characteristics of healthy teeth? Focused. Characteristics of healthy teeth which eruption during 8th month. The child has born, and 8th-month child, he will start getting little bit white spots. Purnata, Sanskrit word, that is complete, all, whatever expected teeth, deciduous teeth and then permanent teeth, temporary teeth, permanent teeth, whatever the number, perfect. Samata, all of equal shape, all should be equal shape. Then Ghanata, they should be strong. They should not be moving. When you eat the hard food stuff, they will start moving. That is not correct. Unhealthy. So Ghanata, they should be strong enough. Shuklata, white in color. Snigdhata, unctuousness. So how to check that unctuousness? You just see the brightness, luster of the teeth. That is called as a snigdhata. Then shlakshnata, smooth. There should not be any creases. Lines should not be there. Roughness should not be there. They should be smooth one. Then nirmalata, no white, no yellow, no brown coating, only clean and clean. That is nirmalata. Niramayata, that is disease free. There should not be pain in the teeth. There should not be cavity in the tooth. There should not be apical abscess. There should not be gingivitis. That is called as a niramayata. Amaya is a disease, no dental problem. Kinchit uttaro unnatata. Upper teeth are little bit anterior than the lower teeth. Little, not like totally out. A little. Then bandhananam, compact. All should be very near. There should not be some gaps. I am sorry. Myself has little bit gaps in between the teeth. Okay. Now I am old, so nothing to be worried. And I am keeping my clean teeth. That I am trying to take my precaution. But here, bandhananam, compact teeth like the artist. You see all the cine artists and drama artists, they are the very, very best. Even the serials, TV serials, everybody has a very good teeth. Okay. Then samata, raktata, bahughanaha, sthiramulaha. Mulaha, roots of the teeth, they should be even, red colored, all roots then big, strong, and stable. So Danta Mool should also be the best quality. So how many there are? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So please write down this number, 11 number. Danta Sampat is equal to 11. You must remember 11. पूर्णता, समता, घनता, शुक्लता, स्निग्धता, लक्षणता, निर्मलता, निरामयता, किंचित उत्तरोन्नत तथा बंधनानां समता, रक्तता, बहुघनः, स्थिर मूलः. Okay. Okay. Now we will try to see about Dantodbhavahanya, but early Dantodbhavahanya. Effects of early, then expectation, then the science. What the teeth erupted at the 4th month are not good. Will be weak, then they can decay early. Just a moment. Decay early and are afflicted with many diseases. So early dentition is not good. They are inverted inside, dirty, discolored, and susceptible to the krimi. So caries can occur earlier. They are split, they are stripped, they are broken, they are dry teeth. Teeth are irregular, teeth are protuberant, coming out. That is called the protuberant. So these are the effects of early Dantodbhavahanya in the 4th month is not good. Is not good. Okay. We will go next. This is the most important topic of today. Most important. I will wait. I will wait. You have to write down Dantodbhavahanya Vyadhi. Very common question on this topic. Dantodbhavahanya Vyadhi. Vyadhi means disease. During the period of dental eruption, the baby, that small child, tendency to take objects in the mouth because gums are irritating. Gums are irritating. Gums. And so the child is craving. Whatever the thing, he will keep it in the mouth. And that carries the infection. So taking all the things in the mouth will happen during the period of the dentition. Okay. This may cause trauma or lead to an infection. Furthermore, the pain during the dental eruption causes mental disturbance of the child as well as may force the child to swallow without proper chewing, and that will cause digestive problems. Agrimandya, Ajirna, Atisar, that we are going to see next. So main thing is, 2 things are there. First, that teeth and all the roots and gums, they are irritated. And because of the irritation, the child takes anything in the mouth and try to, what you can say, the chew. And that particular thing causes the infection. This is the one thing. And then because of that pain, the child sometimes is restless and all the time crying. Okay. And then it makes some hurry to engulf the food without chewing. Because while chewing, the child is getting pain. So the child is avoiding to chewing and it just engulfing. And without chewing, without mastication, if any food goes inside, that will definitely cause digestive problems. I think you are understood what I mean to say. Now, this is the name, these are the names of the diseases given by Vagbhat. Ashtangaruday Uttaratantra 2/27 is the reference. Ashtangaruday, Vagbhat. The name of the diseases during the dentition, Vikara diseases. Visheshat. Especially what diseases occur? Jwar, fever. Fever because of the infection. Then Vidbhed. Vid means Purisha. Vidbhed, that is loose motions, diarrhea. Then Kas, can you see here cursor? Kas, that is here also you can see cough. Chardi, vomiting will start. Then Shiroruja, headache will be there. Shira means head. Abhishanda, here eyes, sclera. Conjunctivitis, redness will be there, itching will be there, pain will be there, and lacrimation. All the water will come from the eyes. That is conjunctivitis. Then Pothaki, pustules, pothaki, and visarapa, that is herpes. Such type of the diseases can occur during the dentition. Okay, we will go further. Now, if the problem occurs, what to do? Chikitsa is a management. Chikitsa, can you see this word? The diseases caused due to eruption of teeth, usually they are mild. They are mild. It's not a very big problem, serious problem. And self-limiting, this word is important. Self-limiting, automatically the symptoms will go away. Loose motions, today there may be 3, 4 loose motions, tomorrow only 1, then loose motions stop. Okay? So as the symptoms fade, slowly go away once the tooth eruption process complete. So what one should not strain the child with laborious treatment. You should not give very strong antibiotics, strong treatment, not necessary. No injections, not necessary. What you can give? Churna of pippali or churna of dhataki pushpa. This is or powder of dhatri phala. Anything, any powder you can take, give it with honey for rubbing over gums. You have to rub that powder. So irritation will be less. Irritation will be less. Dantot Bhed Gadantaka Rasa. A tablet. Make a powder. Dantodbhavahanya Bhed Gadantaka. Gada is a disease. Gadantaka, end of the disease. Rasa with mercury and sulfur, rubbing over the gums. Powder mixed with the honey and rub it gums. For internally, there may be vachadi ghrita. Ghrita is a ghee, medicated ghee. Vacha means Acorus calamus, in Marathi Vekhand. But ready-made not available. Ready-made not available. You have to take prepared from the Vaidya. Next, Samana Gandhi Grita. Samana Gadhi Grita. Actually, this is also not available. It is only mentioned in the text. Kumara Kalyana Rasa is available. Tablet is available. But Kumara Kalyana Grita, very rarely available. Then Pippalyadhyadi Grita. This is also one. All these preparations are not very easily available on Amazon or in the market. Then what to do, sir? You have to prepare with some Vaidyas. Otherwise, you can do another treatments which are available with the market. Okay. Now, let us start to discuss about the different problems. For example, in case of the loose motion, Atisar, again, Pippali, Anjana, and Sharkara, you can prepare the kwath or the decoction. Then Priyangu plus Rasanjana plus Madhu means honey. You can give Dhavana, cleaning. Then Dantodbhavahanya Vyadhi Rasa. Yes, this tablet is available. Immediately after my lecture, go on the Google, Amazon and click this Dantodbhavahanya Rasa. I request all of you to write down me that contents and the action and send it on the WhatsApp. This tablet is available with the Amazon. Then Kumara Kalyana Ghrita. Okay, this rarely is available. In case of the Danta Harsha, my dear friends, I will wait. You write down this word Danta Harsha. Danta Harsha, painful tingling sensation. Painful tingling sensation. Danta Harsha is very similar to hypersensitive teeth. Please write down hypersensitive teeth. In Ayurveda, it is called as a Danta Harsha. Danta Harsha, because of the loss of enamel. Okay. Then Kavala with Ghrita or Taila. I have already explained you. Sesame oil is the best oil. Next. In case of Krimi Danta, caries, C-A-R-I-O-U-S, carious tooth. What to do? Gandusha with Vatahara Dravya or Krumigna Dravya. The simple is Vaudinga Vidanga. You can take Vidanga, Vaudinga, that seeds, and for example, one half spoon of the Vidanga, Vaudinga bija and boil it in a 4 cup of the water. Reduce it to the 1 cup filter it, and sip by sip give it to the child. So that can be helpful to control the infection of the worms. Next, we will talk about dentition process. There are two types of dentition teeth in the human being. One is a primary, that is called as the deciduous or the milk teeth, and second is secondary, which is called as a permanent teeth. You also write down immediately at this moment in your notebook. I will wait. Two types of dentition. Please write down. I am waiting. I am waiting. I am not going ahead. Dentition. Write down. First is a primary. You write down primary or deciduous or milk teeth. All are same. Primary teeth or deciduous teeth or milk teeth. Then secondary teeth or permanent teeth. Please write down immediately. Okay. First primary, second secondary, primary secondary, primary secondary. Milk teeth, permanent teeth. दुधाचे दात. आम्ही मराठीमध्ये we call in Marathi दुधाचे दात. That is milk teeth. Okay. Now, initiation of both dentitions, both occurs in intrauterine period itself, in the uterus, before 9 months. It is gradually, but various process is already started. It is not a complete. Now, this number you have to write down in your notebook right now, because this is very important. Deciduous teeth or milk teeth. In the adult, we and you are having 32 teeth. These are only 20. These are only 20. Please write down. Incisors. This you don't write down per quad. Only write down incisors 8, canines 4, and molars 8. That's it. Don't write down this 1 quadrant, 2 quadrant. No. Incisors 8, canines 4, molars 8, total 20. Milk teeth 20. Milk teeth 20. Don't forget this. And adult 32. Now what is missing? What is missing? Just compare this. Just compare this. Huh? For example, incisors 8 here, milk teeth, incisors 8. No change. No change. Canines 4, canines 4. No change. No change. Write down. Write down. Then premolars here, no premolars. No premolar. Here, premolars are 8. So 8 is an addition in 20. 8 are added. Premolars were milk teeth, no premolars. Then molars here only 8, and here molars are 12. Now you will see these 4 parts. Quadrant 1, for example, here upper right, upper left, upper right, upper left, lower right, lower left, lower right, lower left. So these are the quadrants. Okay. Now here are some specific months are given when these milk teeth are coming and permanent teeth are coming. I think this you can do by yourself, because it is a very complicated thing. But just few things I can tell you. For example, central incisors, they erupt at from 8 month to 12 month. So in the first year, you can see these central incisors and also lateral incisors here. They will start approximately at the age of 1 year of a child. Then canines, nearly about 2 years, because 22 months and 2 years are 24 months. Am I right? So approximately 1 year, there are central incisors. Then there are the 1 year, 1 month lateral incisors. Canines are at the age of 2 years. But first molar is also there during this period of lateral incisor. And second molar is having the last. Second molar is at the last. For example, after, say, for example, 2.5 years. Okay, so this is in general. You can take care of, you can write down all these things in your notebook. Whenever you see, take a screenshot, for example. What to do here? You have to do the pause and then take the snapshot. There is also type snapshot. You can take snapshot and then at ease you write down all these things in your notebook. I will not go into detail of that right now, because I want to give some more information. I will make the screen small for comfort zone. Still I can make a little bit short. Okay, this we have seen. Now at the remaining time, I can add some audio with you. Huh? So carefully listen what I am telling. Sometimes I will dictate also to you. Okay. Dantotpatti, Dantotpatti, dentition. Okay. Where are the references? Please write down the references. First, I am telling you the negative thing. That means Charak and Sushrut are having no reference of specific description about dentition. But in Sushruta has described 15 Danta Moola Vyadhi. Sushrut, not about teeth. Danta Moola Vyadhi means gum diseases. Gum diseases. How many? 15. Gum disease. Sushrut. And 8 number dentitional diseases. Dentitional diseases. I am talking about Danta and references in the Samhita Granthas. But in Kashyapa Samhita, in Kashyap, write down Kashyap Samhita, separate chapter is there. Separate chapter about teeth in Kashyap Samhita. The name of the chapter is Danta. Please write down. I am dictating you audio clip. Danta Janmik. Danta Janmik. Janmik Adhyay. Danta Janmik Adhyay. Danta Janmik Adhyay. Kashyap Samhita. Separate chapter. Okay. Next, we will go further. Dantodbhava Kal that we have already discussed. The child who has a long life, the tooth eruption will start at the 8th month or the later. If the longevity of a child is less, then very interesting, the dentition will start in the 4th month. So you have to ask your parents, father and mother, Papa, Daddy, Mummy, when I have started my teeth eruption. If it is late, around 8 months, you will be long life. If it is early, take precaution. There may be some premature type of the death, just a part of research. I am not claiming 100%. If tooth eruption occurs at earlier stage, because of the intolerable pain, the child will not achieve the complete dhatu development. So dhatu development may hamper if there is early teeth eruption. Okay. Danta Patana Kal, falling of the teeth. Danta Patana Kal. As for the month, the teeth are inseminated. In that time, they appear or erupt. After birth, as per the month, the teeth appear or fall and reappear and erupt in that year again. This is example is a Kashyap Samhita Sutra Sthan 205. 205. For that, you have to go for this. I think we can check whether it is possible to understand by some here, for example. Central incisors, can you see 8th month and it has been erupted at the 8th year. So can you see month and this is year. This is 9. This is also, can you see the 9. This is 16 and 22. This is again. So in that way, you have to compare when it is erupting and when it is decaying. Okay. Then I think we have seen that 4 types of the Dantotpatti, Samudga, then Samvrutta that we have already seen. So I will not go repeat those things which are very clearly mentioned over here. We have discussed about 4 types, this Samudga, etc. Okay. Next, Danta Prakriya, according to Vagbhat. This is new, which is not here. So please kindly write down Danta Prakriya, according to Vagbhat. Danta Prakriya, according to Vagbhat. Please write down. Teeth, I am dictating you. You have to write down. Teeth originate from common sense. You know Ayurveda. You have learned about the Kriya Sharir. What is the relation of Danta? Yes, Vata Dosh. But which is Dhatu? Yes, Asti Dhatu. So write down, teeth originate from Asthi and Majja Dhatu. Asthi and Majja Dhatu. Since they have of incomplete strength, this Asthi and Majja, incomplete strength during the first 4 months of life, these teeth fall off and near teeth erupt again. There is no eruption of the new teeth in the aged if we are becoming adult. And for example, my teeth has fallen down. Is it possible that I will get again teeth? No. No, it's not possible. Because what is the reason? Inadequacy of Asthi and Majja Dhatu. In adult, there is no eruption again. In the child, it is possible, but in adult, not possible. Fall down and again. Milk teeth and permanent. No, not possible. Because of the, as mentioned by Vagbhat, this is not Deshpande statement. This is by Vagbhat, just to know about it. Inadequacy of these dhatus. Dantodbhavahanya Vyadhi. Please write down Dantodbhavahanya Vyadhi. Dantodbhavahanya Vyadhi. I am dictating, my dear friends. Don't waste the time. Write down. Dantodbhavahanya Vyadhi. What is the cause? Why Dantodbhavahanya is there? Write down. Ashtanga Sangraha. Ashtanga Sangraha. Uttara Tantra. Ashtanga Sangraha. Uttara Tantra. 2/21. Second chapter, 21 shlok. Explanation. What Vagbhat has given? Ashtanga Hruday is also Vagbhat, and Ashtanga Sangraha is also Vagbhat. There are two dhatu, Asthi and Majja, which are responsible for the formation of teeth. Now, next topic. We see Danta Prakriya, then Dantodbhavahanya Hetu, then Dantodbhavahanya Avastha. Dantodbhavahanya Avastha. Dantodbhava, eruption, is a continuous slow process from the 4th month of Garbhavastha. 4th month of Garbhavastha in the uterine. What are the 3 avasthas? Kashyap, 3 avasthas. Nishikta, Sanskrit. Nishikta, that is formation of tooth bud, 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 tooth bud. Nishikta, number 1. Number 2, Murtiman. Murtiman is equal to formation of tooth. Third, Udbhedena. Actual eruption of the tooth. So there are 3 Sanskrit words which are mentioning avastha by Kashyap. Nishikta, tooth bud. Murtiman, formation of tooth. Udbhedena, actual eruption of the tooth. Okay. Next, we will talk about factors affecting the teething process. Write down factors affecting the teething process. Number 1, first point. Which factors will responsible or effect on the teething? Number 1, gender. That is linga in Ayurveda, gender. In the female, slow eruption. In the male child, easy eruption. Female, slow, male, easy eruption. Then, on the basis of Swakarma Vishesh, that is nutrition before and after the birth. Nutrition of the child in the uterus as well as after coming out, breast milk, stanya, how is the quality of the breast milk? So these factors will affect even after Kshirada, Kshirannada and Annada Avastha. Everything will affect, food will affect, nutrition will affect, quality of the nutrition will affect the teeth eruption. Third factor, on the basis of Sobhavaja, natural, Sobhavaja. That means whatever the originality is there, according to that person or according to that child, it will happen. Then there are some abnormalities. There are some abnormalities which is mentioned by Kashyapa Samhita. Write down. Write down. Kashyap Samhita Sutra Sthan. Kashyap Samhita Sutra Sthan 20 by 6. 20 by 6. Please write down. Some abnormalities. Sadanta Janma. That means during the after birth, there are already teeth. That is not correct. That is called as amangala teeth. Amangala, not proper, no physiology. Then Purvam Uttara Danta Janmacha. That means before expectation, early or late eruption is also abnormal. Next is a viral danta. Write down scattered teeth. Scattered teeth. Okay. Hina danta. Quick. Hina danta. Less number of teeth. Adhika danta. More than expectation. Overcrowding. Adhika, more number of teeth. Vivarna. Varna. Discoloration. And sputika danta. That is cracked. CRACKD. Cracked teeth. So these are 6-7 abnormal teeth. Amangal. Kashyap Samhita. Okay. Effects of early eruption of teeth. Effects of early eruption of teeth. Okay. If the teeth erupt starting from the 8th month, okay, ideal quality. But early, if teeth erupted at the 4th month, that will be weak teeth. They will decay earlier and afflicted. They will get lot of afterwards problems. Now, if the teeth are coming on the 5th month, they are shaking with morbid sensitivity and they will also get many problems, teeth problems. If the teeth are erupted in 6th month, they will be inverted, inside dirty, discolored, and may suffer from dental caries. If the teeth are erupting 7th month, what will happen? They will be having splitted, stripped, broken, and dry, irregular, and protuberant. So this will happen in the 7th month. Try to understand. So these things you have to compare together. Then we will talk about Danta Raksha Vidhi. Danta Raksha Vidhi. That is dental care. Raksha means dental care. Okay. Dental health. That is the Danta Swasthya. Danta Swasthya. It always depends on the child Prakriti and also the Kala, time factor. Care of the child is very important. So incidence of teeth abnormalities is not normal. So there are many techniques and many methods that you can adopt for keeping the teeth healthy. Danta Dhavana Dravya. Please write down Ashtanga Sangraha. Danta Dhavana Dravya for cleansing teeth. Some plants are there. Number 1, Vata. Number 2, Asana. Number 3, Arka. Fourth, Khadira. Fourth is a Khadira. Fifth, Karanja. And 6th, Karavir. Karavir. Okay. So that is all about the. Then I think we have also discussed about the characteristics of teeth cleaning twig. Previously, we don't have the toothbrush. They just broke up these all the plants. They take the very delicate type of the twig, TWIG twig. So how should be? It should be straight one. That plant twig. Then it should not have the node or injury like cut, or they should not be split by the insects. There should not be paired knots, but it should be very fresh, and the taste should be astringent, bitter, and pungent. These tastes are very good for Dantodbhavahanya. Danta Pavana Dravya. Danta Pavana Dravya. Twig, TWIG. Twig of nimba. Twig of nimba is a bitter. Twig of nimba is a bitter. Khadira, twig of khadira is astringent. And twig of karanja, that is pungent. I repeat, nimba is a bitter, khadira is astringent, and karanja is a pungent. Then we have to select the test according to prakriti. In vata prakriti, we can use bitter or tikta. In pitta, also we can use the bitter or the tikta. In kapha, we have to use the katu, that is pungent dravya. In Charaka Chikitsasthan, chapter 24, Chachi, Charak Chikitsasthan, chapter 24 by 8, Danta Pavana Vidhana. Danta Pavana Vidhana. How to brush? First, I will try to mention some Sanskrit. Don't take tension. Ekaikaha gharshaye danta. Ekaika, single. Gharshaye danta. Mrudunam, like this. Mrudunam, softly. Kurchanena cha. Danta shodhana churnena. Danta mausasya badhayam. Each tooth should be rubbed individually with a soft brush made by chewing the twig without crushing and damaging the gums. It means holding the medicated liquid or the dravyas in the mouth. Okay. Now there are also references of gandusha, but gandush should be done after 6 years of the child. That is mentioned by Sushrut Chikitsasthan. What are the benefits of gandusha? Mukhavairasya, clean. Daurgandhya, Mukhavairasya, Daurgandhya, Shofaja, Jadya, Haram, Sukham. That means it will clean, eradicate the Mukhavairasya, means loss of taste. So some patients say, doctor, I don't want to eat because there is no taste in my mouth. So what to do? Cleaning the teeth is very important. Gandush is important. It will, virus means loss of taste. It will remove that problem. Virus will be lost. And Daurgandhya, halitosis, bad breath will be lost with Gandusha. Then it will reduce the, if there is any edema, inflammation, it will go away. Heaviness in the mouth, it will also go. Okay. Then there are 3 types of Gandusha. 3 types of Gandusha. One is Udaka, simple water. Sneha Gandusha with the sesame oil. And Kashaya Gandusha, that is Triphala decoction. So, Udaka, water, Udaka Gandusha. Sneha Gandusha, sesame oil. And Kashaya Gandusha, Triphala, actually the decoction. Then, even the eruption of the teeth may be the cause for many diseases. For example, Jwara, Atisar, Chardi, Visarpa, Pothaki, etc. What is the Samprapti? What is the Samprapti? Is a pathogenesis. Please write down. Samprapti is a pathogenesis. Okay. Asthi and Majja Dhatu on maturation and reach to the Dantakshaya. Tooth sockets will be there and produce some irritation. Then child will feel itching sensation on the gums due to the kapha situated in the gums. So child may bite during the feeding. The child bite and presses it against the gums to relieve the itching and pain. Then vata will aggravate and the association of kapha reaches the gum and enters the asthya and majja dhatu and spread the whole body. At the same time, vata itself or with the help of pitta vitiate the other dhatus and malas and produce the complications during the dentition. So these are the general description of the samprapti, why the dentition disease, Dantodbhavahanya Vyadhi, samprapti, that is pathogenesis. In short, we will see last point. Asthi majja dhatu vikruti gets maturity or ripens. Asthi and majja dhatu, this problem localizes in the dantashaya, that is the gum or the socket. Slight swelling and horripilation due to kapha. Then there will be nipple bite. Aggravated vata gets localized in the root of the teeth. Vayu gets penetrated in asthi and majja at that particular site. Vitiates the dhatu and association of pitta, lot of complications will take place and secondary disease will happen. My dear friends, this is all for today because we have made a lot of discussion on the dentition problem. Thank you very much, and we will continue our further class of Swastha Vritta on Sunday at round about 11:50. Till then, I wish you all the best. Take care and see you soon. Thank you.